Dr. Hayley Reid. I'm going to be presenting live to you today on the 4 themes which you can see below. So I'm going to give you an overview of the research team who's behind the development of this school level digital dashboard. And then I'm going to talk to you a little bit about phase 1, which has already been completed, which was the initial co-developing of a dashboard prototype. I'll be moving on then to talk about work we are currently just starting, which is around piloting that dashboard with secondary schools in Wales. And the last thing is that we've got a pre-record, which is a dashboard demonstration from my colleague, Dr. Nick Page, to show you through what we have in terms of a prototype currently of the dashboard. So, the project team for this is members of Cardiff University researchers who have a wealth of experience in health improvement. Particularly, lots of us work on school-based studies for young people's health. We've worked very closely with the SHRN team, the Schools Health Research Network team, to be able to get this project off the ground. And also the third kind of connecting piece to this is that Cardiff University IT systems are the people who have been developing the dashboard, so doing all the coding of the dashboard and trying to bring to reality what our stakeholders they would like in terms of a dashboard for the Schools Health Research Network data. This project was actually externally funded. We approached a funder who's called the Wellcome Trust, and they had a specific data prize, they termed it at the time, where they wanted to work with teams throughout UK and internationally to develop up digital tools that can be used by a variety of stakeholders to think about health and wellbeing data. We were one of the teams who were selected to do this, and actually there was a second round of funding, and we have been selected, as you will hear, to have the second round as well. So we've won the prize, is what they said in terms of this. And the product from this is that we hope to have the school level digital dashboard. At this point, we know that the pilot will continue till the rest of kind of mid-2024, and then we will need more refinement work. We don't expect any dashboard to be live for schools for the next year to 18 months, due to the fact that we are just in the kind of piloting stage. Throughout all of the work we've been doing, we've had an advisory group which have included school staff, members of the Public Health Wales, so this has been some of public health consultants. We've also worked with Healthy Schools coordinators. We've also linked up with researchers from other school networks. So, for example, there's the Shine network in Scotland, who also have been doing some work on developing dashboards. They have been doing this at a more national level, and we're doing it at the school level, but we've still worked with them in our advisory group to help and support us to ensure that we've got the best dashboard possible. The aims is obviously to enable schools to digitally access and understand their SHRN data to support health action planning within the school. Phase 1, which is the co-development phase, was to involve multiple stakeholders in the co-development of the dashboard to ensure it has appropriate functionality. And phase 2 looked very much at assessing more around the functionality and feasibility of using the dashboards from schools' perspectives and to understand professional learning needs for staff. And I'll talk a little bit more about that in a second. So phase 1, the co-development used a user-centred design methodology. This is a methodology which has been used to develop other digital technologies and tools for health improvement or other areas of health. We've used cycles of user involvement to refine the dashboard. So we started off very early with working with users to identify the needs and functionality they would like in a dashboard. Part of this was we gave examples of other dashboards to stakeholders so they could look over them and they could tell us what they liked and didn't like about those dashboards. Whilst they were dashboards which had data, not all of them, like I say, were at the school level. Some of them were national level tools and dashboards which they kind of gave feedback on. This was done through focus groups with school staff and consultation with our young people's advisory group. So we've had 2 advisory groups. one from our research centre in DECIPHer, which is a public health research centre. We have a group of young people who advise on all of our studies. And the second is a group of young people who advise the Wolfson Centre, which is about children and young people's mental health specifically on projects. From this, we developed up a paper-based mock-up of the dashboard. This was then some of you may have actually seen this because we did consultations at the Shern summer events with over 60 schools. So we gave an idea on paper of what this dashboard would look like. We also did the same things with the public health workforce. So this included healthy schools coordinators who can support schools in terms of health action planning and implementation coordinators for the whole school approach on emotional and mental well-being. After taking back all the feedback from the kind of mock-up, we got the developer from Cardiff IT to create a prototype dashboard. So this was our first version of a prototype dashboard. And over the summer, some of the teachers here again would have been involved in workshops with school staff, which looked for the first time at the prototype and gave more feedback. Our young people's advisory group were involved again, and we had our advisory groups, which I talked about earlier. And we've made further revisions since then. Some of the areas, I haven't got time to talk about all of the areas we had kind of discussed, compiling all of that data. We knew that functionality-wise, what schools were very conscious of is they were very happy with the charts which were already in the school reports. However, they wanted to be able to see trends over time. So, for example, currently, if you wanted to look at trends over time, you'd have to get multiple reports out and look at different data on different graphs, whereas we do have graphs which show that kind of trends over time. This is something you'll be able to see in the dashboard demonstration next. There was some information about the fact that people still wanted to have something quite tangible if they could in terms of reports. Now, whilst we won't be printing out and sending reports once the digital dashboard is completely rolled out in the future, and as I said, this is very much a year to 2 years down the line, there is an option on the dashboard to be able to download PDFs of the charts, of the in tables as well. People told us that they wanted to use easy to navigate graphs, and we did use basically the graphs which are in the report, and there's another graph which Nick will show you later. The other two areas which people, particularly schools, were really interested in having access to on the dashboard were tabs where we could have case study examples of how other schools had used their data and supportive resources, so links to things which can help schools. We are in the process of, we have them on the dashboard, but we will very much be working them up a lot more after we've done the pilot with the schools. So this will be something that we will definitely be focusing on in the next stage. In terms of the design, people wanted it to be quite simple, easy design. They didn't want it to be cluttered. So we've kept it, as you will see, quite easy and kind of plain background. In terms of being able to use the dashboard, we have produced manuals in both written forms and in a video form. So you're able to look at what is a user manual with downloads from the dashboards to be able to look at the different functionality. And also there is a video on there of someone showing you the different functionality you can use. Lastly, in terms of understanding the data, there were questions around whether we could have access to the questions which were in the survey, which would be able to support people in understanding the data, access to the actual data tables, which, as I said, we have got. The last thing we wanted to raise in terms of this stage was, at one point when we did the initial prototyping of the dashboard, there was an option to compare variables. However, there was some anxiety, I suppose, around the fact that this could be misunderstood in terms of people thinking that one variable has caused another variable, and that was not exactly what we were thinking it should be used for. So that again can be something we can refine going forward. So in terms of going forward now, we have phase 2 to come. We started phase 2 in January 24. It will continue till May 24. This is being led by our colleague, Dr. Sarah Long, who has a lot of experience in working in the curriculum in Wales and working with schools in terms of data. So she'll be leading this pilot study. They'll be recruiting 4 schools and they'll be asking staff, where possible, to have 3 staff from the school, including someone from the senior management team, the link teacher, potentially for Sian, and somebody else involved in health improvement. And we would hope that the schools would be able to link in with their Healthy Schools coordinators. What we will do in terms of this dashboard is that people will be given instructions and videos on how to use the dashboard. And then as a team, we would like them to go forward and use the dashboard. And then interviews will take place with people during those follow-up periods between January and May to see how they found the functionality of the dashboard, how feasible they found it to use to support health and wellbeing action planning. But also we would like to get some information back about some of the pragmatic things in terms of accessibility, who has access and how we do that. So should we have one school login or multiple logins for different people? Aesthetically, does the layout and design do things like maximise inclusivity? What we hope to get out of this second phase is that the dashboard will be refined. We've very much focused up until now a lot on the data kind of offer, so replicating what you get in terms of the report and enhancing that where we can. But the pilot will really explore how to include some of the areas which we haven't had chance in the previous phase to do. So as I said, those in-depth case studies and the supportive resources for schools. Also, Sarah will be focusing on some of the professional learning needs of school staff to use this data. So obviously giving schools access to the data is one thing, but being able to understand and use the data within the schools, there may be things which staff within Wales, there'll be a variability of skills. There may be common things which people think would be pertinent in terms of the professional learning offer for using the dashboard. And the last thing is, during this phase, there could be collected some ideas for potential resources to support the dashboard. We don't expect at the end of this to have resources developed up. We would just have an idea of what resources people would like. So thank you very much for listening. We're now going to go on to a pre-record demonstration of the dashboard, which has been recorded by my colleague Nick Page, so you can have a look at what we've produced so far. As I said, this is something which will be refined in phase 2.
Welcome everyone, I'm Dr. Nick Page. I work as part of the Sian team at Cardiff University, and I'm also currently co-leading on a Wellcome funded project to co-develop a digital dashboard that will enable schools to better access and explore their Sian data. This short video will explore our initial prototype dashboard that has been co-developed with school stakeholders and which is freely available to access from the DECIPHer website. Now, as you all know, every 2 years the School Health Research Network conducts its National Student Health and Wellbeing Survey across schools in Wales. In 2021, the survey was completed by over 123,000 11 to 16-year-olds from 202 schools. So this was the third survey round to collect data from over 100,000 students, following surveys in 2017 and 2019. So as schools are now beginning to amass quite a substantial time series of Sian data that can be used to help inform school level actions to improve student health and wellbeing, Sian has decided to move to a more digital offer and explore the potential for a school level dashboard. So to be clear, the following demonstration is based on an earlier prototype version of the dashboard. And that's what you can currently see on your screen at the moment, and which I'll go through in the following minutes. So work is currently ongoing to refine the dashboard in preparation for national rollout in 2025. So that includes changes to the dashboard aesthetic. So again, this is only a prototype, which way it may look a little bit clunky in places. The long-term vision for the dashboard is that it will replace hard copy school feedback reports. So the data used as part of this demonstration and to populate the prototype is referred to as dummy data. So this just simply means that it does not correspond to any one school's data. So when the dashboard is eventually operational, it will provide schools with secure access to their own SHRN data. This data will be anonymised and aggregated, which aligns with SHRN's current approach to school feedback reports, meaning no individual student data is ever shared. Each school will be given access to its own data only, meaning no school's data will be visible to other schools via the dashboard. Again, long-term, schools will be provided with a username and password to log into the dashboard, which will be hosted on the Cardiff University secure servers. So again, this is just a prototype, so not all functionality is currently available. So once you have logged in as a school, you will land on a home page. So again, something potentially like what you see before you. So this will introduce you to the dashboard and provide you with information around interpreting the data. So currently in the prototype, the home page is one of 4 main sections included within the dashboard. So if I scroll down, you can see a standard welcome, and at the moment there is a user guide and a short introductory video. Again, some of these are predominantly placeholders that would be further refined before national rollout. So in terms of the sort of 4 sections, so this would be the home page or the landing page following login. You then also have access to the school dashboard tab, which is where you as a school would access your own data. Also case studies. This is where schools can access examples of how other schools have used SHRN data, and also supportive resources. And this is a section where schools could be signposted to resources and organisations that can help them when they're planning actions and using their SHRN data. So what I would say is part of our prototyping work, the case studies and the supportive resources sections, these were things that were requested or brought up following our consultation process. So actually within the prototype, these 2 sections are predominantly under development. So any content currently within them is mostly just temporary and will be expanded upon as part of our future development work. So just to note, the focus of the prototyping phase of the dashboard development has really been on the SHRN data itself. Hence why the case studies and supportive resources sections really are, the content within them is mostly a placeholder. So if I click on the school dashboard tab, this takes us to where the SHRN data is displayed. So here you'll see 6 themes running horizontally that correspond with sections within existing school feedback reports. And that's here. So we've broken the survey measures provided back to you into these themes, which is food, physical activity, well-being and emotional health, substance use, sex and relationships, and school life. And if I click, you can navigate across different thematic areas quite simply. On the left, running vertically, you'll see the question headings included within the theme that you can navigate between to access the data you require. So for example, under the food thematic area, you have questions around breakfast consumption, fruit and vegetable intake, consumption of water, energy drinks, and sugary drinks. And if I was to click on any of these, at the moment you can see it would navigate through the data available for those questions. The data are displayed in the same way for each chart, and that again is largely consistent with the existing school feedback reports. The question has been included above the charts. So here, for example, we're looking at breakfast consumption. The question that the pupils would see is, how often do you usually have breakfast, more than a glass of milk or fruit juice, on weekdays? The response options available were, I never have breakfast during the week, 1 day, 2 days, 3 days, 4 days, 5 days. The chart below therefore presents the percentage of students who reported eating breakfast every weekday. So that's how the breakdown is calculated here. So it's a binary. Gender and year group percentages for each survey year are provided with national benchmarking, which again is similar to current reports. So again here, if I hover over the charts, you can see the percentages will appear. So this, again, this is obviously dummy data, so it might not reflect sort of true patterns within the data. But here you've got males, 64% of males in year 7 reported eating breakfast every weekday. That was in comparison to 54 females. And the total for year 7s in this particular school, again, this is dummy data, would be 59%. So again, you can see that's the breakdowns provided across the year groups. And again, if you surveyed year 12 and year 13 pupils, that data would also appear. And again, similar to the school feedback reports, you also have the national male average and the national female average for each of those year groups for benchmarking. Is available again as per usual. What you can also do is you can also toggle on or off by clicking below, so you can remove certain elements of the chart if you so wanted. So for example, I can move the gender breakdown and you could look there at year group. Again, I can take off the national and you could look purely at the year group breakdown for your school. Currently, that chart is provided for each survey round, so hence that data only refers to 2021. The 2019 data is provided below, and again, if your school has participated in a number of waves, the 2017 data is provided again below that for comparison. Moving forward, we'd like to move to a place where actually you'd only see this chart once, and you'd have an option to toggle through the different years of survey data you have available to you. So that would appear as one chart with the option to change to different years. The next chart that we have, which is different to the above, specifically looks at your school average over time. So again, here we're looking at breakfast consumption. So this is your school average for 2017 to 2019 to 2021, and also that same school average by gender, so male and female, so that you can track changes over time. We're also currently exploring additional chart options. One might be, for example, to explore a very similar change over time, but with year group breakdowns. So you could potentially track any changes in a cohort. So you could see how your year 7s in 2021, for example, compared to your year 7s in 2019. Moving back up, you'll also see that we have here a hamburger menu. This allows for charts or the data tables underpinning those charts to be downloaded for ease of sharing. So here you see you can view in full screen, but you can also print the chart or download the image. Or also, if you're interested in looking at the data, now at the moment this would be the percentages, not the raw numbers. You could also access those via a CSV or Excel spreadsheet. Again, moving across the different thematic areas, you'll see this is exactly the same wherever you go. So for wellbeing and emotional health, if we look at bedtime, you have the question at the top with the different response options and how the binary has been created for the charts. And then you have the exact same chart formats for the 3 years, and you have your trends over time. As I said previously, both the case studies and supportive resources sections are under development, but the prototype includes some basic examples for the purposes of demonstration. So for instance, here with case studies, we've had some simple examples of how other schools are currently using their shown data. Now, this is not an endorsement of best practice, but it's just simply some feedback we've had that some schools would like to know how others are using their shown data within their practice. Again, this is something that we're going to explore in time and to try and provide sort of greater detail in an expanded section. Similarly with supportive resources, this is currently also under development, but here some examples have been provided. So we provide here signposting to the new Sherne Local Authority dashboard, which was developed in partnership with Public Health Wales, and this provides free access to Sherne data over time for all 22 local authorities. So that's really useful to explore local comparisons. We've also got information about the Welsh Network of Healthy Schools schemes, whose local coordinators can help schools to interpret their Sherne data and plan appropriate actions. And also here some resource from the Welsh Government. So here is the Whole School Approach What Works toolkit. So again, in terms of the sort of signposting that could be useful to schools, or the information that could be useful in terms of case studies or supportive resources, are further being explored at the moment through our sort of third phase of funding for dashboard development, and this involves the pilot work with schools. So all of the information and the data that we collect in the next few months will then be input back to the dashboard for further refinement of case studies and supportive resources sections, but also in terms of just further development work around the data and interpretation of the charts and any additional information that would be required. I hope this quick video has been informative and gives some insight into our ongoing dashboard development work. We hope to be able to share future developments with you later in the year, including the new version of the dashboard with its refined aesthetic and functionality. Thank you very much.